special segment tonight, beating your back pain. It's something that millions of people can relate to. And for those trying to find relief, surgery is often a common option. But it's not for everyone. Hot Seat reporter Sylvia Perez joining us tonight with an alternative that is supposed to be gentle and painless.
Kathy, for anyone who's ever dealt with back pain, the word painless is more than welcoming. Many people with back pain are willing to do or try just about anything to prevent surgery and make that pain go away. One option is a method that's been around for a while, but it's now been perfected and is promising a very big success rate. Meet 61-year-old Wayne Paulson, a former football player and active adult. This is 22-year-old Lisa Leonard. The young college student keeps fit and stays in shape by working out. So what do Lisa and Wayne, who are years apart, have in common besides exercise? Both have suffered excruciating back pain.
It was terrible. It went through my hip, down into my leg, my lower back. I mean, it hurt to sit, stand.
I actually couldn't walk. Walking was very hard for me to do.
And both say they beat the problem thanks to this machine. It's called the Lordex system.
What this is doing is actually speeding up the process for healing.
It's supposed to work for all kinds of back problems, including herniated and bulging discs, sciatica, and knee and leg pain. The machine basically stretches the back. First, the patient is strapped or placed in a harness. Then, they're hooked up to the Lordex. While laying down with the legs propped up, the machine gently goes to work, slowly pulling and stretching.
We are segmentally tractioning that specific disc, bringing in the nutrients and oxygen and so forth, where actually a disc is actually being sucked right back in between each vertebrae.
And Horbatz, who's a doctor of naturopathy, says patients will feel relief after 2 to 3 sessions, and by the 8th to 12th session, the pain is usually gone. But they recommend up to 25 sessions to strengthen the body and prevent further back problems. At a cost of $195 per session, you have to ask, does it really work?
If there was a single device that would cure people of back pain, then I wouldn't have a job.
Dr. John Ratliff is a spine surgeon at Rush University Medical Center. He says 90% of people who have back pain will recover with no treatment at all. He's not so convinced machines like the Lordex are worth the investment.
Time is your greatest ally in treating back pain and in treating leg pain from a herniated disc. So therefore, a lot of this stuff works simply because it gives you something to do.
The Lordex is similar to other machines on the market that promise relief for back pain with the use of traction, including one called VaxD. Both Wayne and Lisa are convinced the Lordex is the best thing that's worked for them. Wayne's had 4 surgeries. Lisa's tried several things, including rehab, before trying this.
It helps. I mean, I recommend anyone to come here.
Now, the Lordex system may or may not be covered by your insurance, and some medical doctors are concerned that there's just not enough scientific studies to prove machines like this work, but at the same time, there doesn't seem to be a lot of concern that they can cause any harm.
And when it comes back to tonight's Medical Watch, easing back pain without surgery or medication.
As medical reporter Dina Baer shows us, it's pulling patients up after years of feeling down.
80% of people will have back pain after age 40, a scary statistic. And given the constant demands of everyday life, the strain on the back will continue, but the pain doesn't have to.
The pain was such that you couldn't sleep, you couldn't walk, you couldn't sit at your desk, you couldn't do anything.
Walking for years on bad knees, Barry McRae put crushing pressure on his back. Soon his activities came to a crashing halt.
My favorite sport is golf, and I did not play golf at all this summer because the pain was just so bad.
Take a deep breath in. As you're going back, blow it out.
The goal is to blow out the discomfort by removing the cause of the pain, in many cases muscles out of alignment, putting uneven pressure on the discs.
One muscle, if we look here at this diagram, one muscle may be tight on this side, yet stretched on this side, giving us a herniation.
So the fix is twofold. Build up supporting muscles so the disc repair will hold.
Not only do we take the twist out of the spine or the torque by actually having the patient actively doing exercises and rebuilding, but we're also then taking out the herniation of the disc through segmentally traction.
That's where the Lordex spine system comes in. First, pulling the spine into place.
You're going to get a 45-second pull like this, 15-second release, 45-second pull like this.
Then it's strengthening and maintaining.